name is Laura Limmeyer, and I come before you, the congregational members of the United States of America, as a registered nurse that actively participates in the Catholic Church, as well as a representative of the All-American Life League organization, From Creation to Natural Death. Our mission statement is the American Life League exists to serve God by helping to build a society that represents and protects individual innocent human beings from creation to natural death, without compromise, without exception, and without apology. The distinguishing mark of American Life League by which we will be recognized is our absolute commitment to the sacredness of every innocent human being's life. I want to express my position on ending one's life, whether it be abortion, physician-assisted suicide, or the destruction of an embryonic cell. Whether you are committing an act to one of the previously mentioned areas of healthcare, or are a supporter, I stand before you to explain my position on why we should not aid in the support of ending one's life. Each and every physician takes the Hippocratic Oath in order to practice medicine. The oath states, "I will follow that method of treatment which, according to my ability and judgment, I consider for the benefit of my patient, and abstain a lethal dose of medicine to any patient, even if asked, nor counsel any such thing, nor perform the utmost respect for every human being, or for every human life from fertilization to natural death, and reject abortion that deliberately takes a unique human life." Each physician agrees to abstain from the harmful acts. It is clearly stated in the Hippocratic Oath that the physician will not administer any lethal dose of medication, regardless if it is requested by the patient. When those patients that are in the end stages of life, either due to natural causes or from cancer, they request to be made comfortable or to be prescribed barbiturates to end their life of pain and misery. If a physician agrees to administer the barbiturates and to participate in physician-assisted suicide, they are going against the oath of physicians. They also agreed to have the utmost respect for every human life, from fertilization to natural death. At the moment of conception, the cells are considered viable human life. The physician should not participate in the disposal of embryonic cells as well as abortion unless the fetus is not viable and will not be able to withstand life outside the mother's womb. I could understand how one might argue the opposing viewpoint on ending a life. There are some cases that might present a viable stance regarding the positions of ending a life. Yes, putting a patient out of their misery when they are suffering at the end of their life seems like the right thing to do at the patient's request. Yes, ending a life of a fetus whose mother was a victim of rape seems like the right thing to do also. I can sympathize with an abortion of a fetus creating harm or possibly death to the otherwise healthy mother. In such a case, the fetus will more than likely not be a viable human being outside of the mother's womb. I am asking you to please take these thoughts into consideration, as well as the idea of disposing embryonic cells, abortion, or physician-assisted suicide, and consider making these illegal nationwide. Thank you.